Here's the EKG with the heart rate, non-invasive blood pressure.
During years of intense training, new doctors learn their craft in an old way, by apprenticeship. Student doctors in this case are trying to figure out quickly why this patient's heart has stopped beating.
What do you want to do?
Up here.
Shock him again.
Yeah,
Shock him
you just
again.
keep doing
Okay,
it.
hit him again. Bang. What happens? Nothing.
This is no ordinary patient, and this is no dummy. It's a computer-controlled human body simulator. It can be programmed to simulate all sorts of medical problems, from heart troubles to obstetrical problems to breathing difficulties. The patient simulator is designed to create realistic learning experiences for students at the Penn State College of Medicine. It has a pulse and breathes like a human would.
The simulator also has the capability of administering drugs.
A barcode reader senses and measures when drugs are administered. In this case, atropine is given and registers later on this screen. Heartbeat, blood pressure, and respiration are measured and shown on a computer. And that's not all.
And the chest is actually moving. You can see the lungs moving up here. And these lungs are consuming oxygen and they're producing CO2. So if you try to obstruct this totally, then he will obstruct and he will actually die.
When anesthesia is given, the simulator does what a human might. Its thumb stops moving when enough drugs relax the patient's muscles.
This is very, very good for patients too, because the first time that the doctor or the medical technician now does something isn't practicing on your child or on your grandmother, because they've done it 10 times, 20 times on the simulator, and they know how to do it.
Penn State is among just a handful of hospitals and medical schools worldwide using the patient simulator for training medical technicians, nurses, and doctors. On this day, student doctors tried to revive the patient after it was programmed to stop breathing.
It's having the actual monitor changes and the breathing changes that we can see. Really, it can be very convincing, I think, especially when your attending's there saying, "Come on, he's dying. Come on, he's not breathing," and that can be a very realistic scenario, actually.
In a sense, we can do what they would normally be doing on a day-to-day basis without causing any injury or problem, without experimenting on patients, and so they get up to speed much quicker.
This is where real-life medical dramas are played out, the emergency room of a major hospital. But it can be an expensive and sometimes dangerous place for medical students to learn their trade. The one-time cost of the patient simulator, about $200,000. The long-term benefit to patients, better trained, more confident medical personnel. Dick Wilson, CNN, Hershey, Pennsylvania.